not the main one, but there's, right now, he's on the other side, and then you go around and then. Yes, yes, he is posted around. It's a nice to bring it on, and then our friends, that my brother kind of grew up with Jason and Lisa Elton, they live there full time now. Lisa's parents live there full time now. My brother lives there, but he's actually, not far.
Yeah, you don't mind.
From out of the way, camera.
She does have a dog. That's what I see.
Okay, cool.
That is
Thank you.
Good afternoon, everybody. We'll go ahead and get started. It's just at noon. We'll be respectful of time and schedule. So thank you, everybody, for being here, both those of you who are here in person and those of you who are fancy today. We're on Facebook Live, so thank you to everybody who's able to join us virtually. Your presence today means a great deal to us, and we're grateful that you've taken the time to be a part of this important conversation. As you know, today is National Fentanyl Awareness Day, and the Wilson County Substance Prevention Coalition is both honored and humbled to host this remembrance event. We recognize the complexity of fentanyl misuse, and the profound impact it has on our community, both broadly and personally, within our own families and friendships. So today we want to come together with a shared purpose to raise awareness about the dangers of fentanyl, to honor the lives lost to fentanyl-related overdoses, to inform our community about the resources that are available, and to work towards preventing future overdoses. We are deeply appreciative of the role each of you play in this effort, whether it's through your work, your advocacy, your support, or even just by being here today. Together, we want to create a space for remembrance, for learning, and for hope. We have a list of just wonderful speakers and presentations today, and I'd like to kick us off with Ms. Lisa Bennett.
Thank you for having me today. My name's Lisa Bennett, and in February of 2023, I lost my beautiful 22-year-old son, Mason, here in Wilson, fentanyl. He was a full-time college student, and he worked basically full-time at Starbucks and Target, so a lot of people remembered him from that. He was just a good kid. He was 22 years old. He was starting to kind of figure everything out. You know, he was role model to his brother, who was 4 years younger. But all of that ended on February 22nd, 2023, when he was found by his roommate. He, we later found out, had been sold what he thought was a Percocet by a friend, and this pill contained fentanyl, and it cost him his life. Sorry. When Mason died, I knew nothing about fentanyl. The only fentanyl I knew about was the type that they use for, cancer patients, in a hospital, in a controlled setting, that had been made in a lab. And so even when I was told fentanyl initially, that was in my mind that this was something that someone had taken from a hospital and had given him. And so it took a little while, and a lot of, just researching and studying to figure out what had actually happened. I didn't know that fentanyl was approximately 100 times more potent than morphine, and that it's mixed with many, many other illicit drugs. It's really cheap to make, so they don't mind piling it in there. And whenever they're mixing these substances, they're not doing it in a lab. I've seen videos of it being done in garages, in Lowe's buckets, like you see, at Lowe's, those blue buckets with mixer like you use to mix grout with. So you can imagine that when when this drug is mixed in with this, whatever they're using for like filler, it's not an even mix. You know, some little area over here may get hardly no fentanyl, this area over here gets a huge amount of fentanyl, and it's just kind of the luck of the draw of who gets what. The DEA, one of the things I was reading, they found that 42% of the pills that they tested for fentanyl contained at least 2 milligrams. 2 milligrams can be a lethal dose to someone, especially someone that is not heavily using drugs and doesn't have any tolerance to it. And sadly, that's what I see a lot of people die from, are those that don't have a tolerance, that they're experimenting. You hear, the kids, they bought a pill and, took it and never woke up because they didn't have any tolerance. Drug traffickers typically traffic fentanyl in kilos, and a kilo of fentanyl could kill almost 500,000 people. I mean, there's enough lethal doses in that to kill over 500,000 people. It is now the primary cause of overdose death, and I really hate to call it an overdose death because I don't think there is a safe dose of fentanyl. It's not like, they took 10 times more than they normally took or anything like that. I mean, this is somebody taking something that they have no clue what is in that pill. The only way to find out what's in that pill would be for a lab to test it. You can use fentanyl strips to see if there's fentanyl in it, but that's not going to tell you the amount. Since 2016, fentanyl has taken more lives than heroin and prescription opioids combined. So this is something that came on the scene, especially around 2016 is when it really started popping up and being such a major player in the drug industry. And since then, I mean, it's just taken over. I mean, it's making all this other stuff seem like, just child's play. Between the years of 2021 and 2024, we surpassed the number of U.S. individuals killed in Vietnam in each of those years. Each of those years, we had more individuals killed in the United States from fentanyl than we had killed in the entire Vietnam War. And we did that for 4 years. The numbers have dropped off some, which is great, but honestly, I don't know what the good number is. In 2023, we were averaging 199 deaths every day in the United States. Unless a pill is prescribed by a doctor and dispensed by a legitimate pharmacy, it is not safe. There's just no way of it being safe. Like I said, they don't have pharmacists back there mixing these pills. These guys are dumping it, like I said, it looked like they were mixing grout whenever they were making these pills. One thing I've learned, and I don't know if it makes me feel better or not, but when you take fentanyl, it affects the part of your brain that tells your body to breathe. And that's one of the reasons that it kills so many people, because if you have too much of that, it tells that part of your brain, you don't need to breathe. And after a couple minutes, your heart gets the message that it doesn't need to beat. So in some ways, I guess that's kind of a peaceful death. But I don't want to imagine any death for my child, and I don't think any of the other parents did either. I was glad to know it wasn't painful that we know of, but once that happens, once your breathing stops and once your heart stops, the only thing that's going to reverse that is Naloxone or Narcan. It's the only thing. And there's been cases they give them the Naloxone. One of the reasons they say you need to stay with them, you need to make sure that they get to the hospital, is because it can stop it for a certain amount of time, but if depending on the amount they take, it could start back up. And so they could overdose again from that same amount they took to start with. So you definitely need to make sure that they get, help if you ever help somebody that's overdosing. But me and too many other parents in this room, we're the ones that are left behind. Our families deal with this. We can't get them back. Only thing that we can do is try to help save some other people. And I can tell you, speaking for myself, it's not fun. It's not something we want to do. It's very emotional when we do this, but it's the only thing that we can do for them at this point. If you have children, young, adolescent, early adults, talk to them, tell them about this, talk to them over and over again, tell them about it. Like I said, I didn't know, so I didn't talk to Mason about this, but I do talk to my younger son, who's 21 now, and I'm sure he's tired of me talking about it, but it's gonna keep on. I'm gonna keep talking. If you can carry Naloxone on you at all times and be prepared to help somebody. I saw a man today was going down the road and he was laying on the ground, and I thought, okay, I'm just gonna pull over and I'm gonna Naloxone him. But then I saw him grabbing his ankle and I thought, well, I didn't do anything about that. But I do have it in my car. I have it at my house. I have it, just about anywhere I go. And then I know there's a lot of people here that really do a lot of stuff to help people that are suffering with addiction and are trying to get help. And I know that y'all have been a godsend to some of those people, and continuing to do that because they deserve to get better, they deserve to be saved, and they deserve to be here, just like our kids. If we only get down, and we were able to look at the numbers and only have 5 deaths this year. I was looking at the numbers, and they have gone down substantially over the last couple of years. In my opinion, and somebody that does more studying of this could probably say whether it's true or not, is because of the awareness and because of the naloxone availability. That's my thought. I don't know, if there's some other secret thing that's going on that's helping, but the numbers are going down. The most recent numbers we had for January, they're always months back because it takes a long time to get back toxicology reports, but in January, we had no deaths in Wilson County, which is great. January of last year, we had 1, so we were down 100%. Again, sounds great. But if we only had 5 for the year, you start thinking, well, that's only 5, but I promise you, those families of those 5 people are not going to feel better about that. Like, that's not going to make them feel better that, oh, well, there was only 5. Each of those people have a family, they have people that care about them, they have a future, and that's what we want to see is, them get the help that they need, and that they stay safe and they stay alive. We've got to keep talking to our kids. We've got to keep educating the community. We've got to keep working with these wonderful things that y'all are doing with the ability to get the naloxone out of the little boxes or the 1 boxes that you put all around town. I mean, all of that, I swear, is making a difference. There's no way you could convince me it's not making a difference. The most important thing to me with kids is that they have to see that you cannot experiment with pills. I know that that's part of being an adolescent is you try these things, you try the alcohol, you try smoking pot or whatever, but pills you cannot try. You cannot experiment because all it's going to take is 1. Same thing with cocaine. Most of the cocaine that they're finding now has fentanyl in it, which I don't understand. To me, that makes me think it would do the opposite of cocaine, but I don't know. And, you hear of people, they took 1 little hit of cocaine and they died. So that's where really, I think, have to focus is trying to make these kids understand, because that's what's so terrifying is kids thinking that they're going to try this one time, just see what it does, and then they die. But this is my Mason. Like I said, he was 22. He's a great kid. Wasn't perfect, but he was a great kid, and he deserves to still be here. Thank you.
This moment, we want to allow each representative here, if you would like to stand and acknowledge your loved one and share their career age, we'll give everybody a moment to do that. If you would just kind of stand up here, that's fine. Go to line up.
Just, yeah, just go for photo and send it to them.
My name is Becky Stansel, and this is my son Walker Black, and he is forever 21.
I'm Missy Lamb, this is my son Chess Lamb, and he's forever 30.
Lisa Bennett, this is Mason Bennett, and he is forever 22.
This is Elena Mooring, I'm her mom, Tina, and she's forever 24.
This is my son, Al Douglas Langston III. He's forever 24. And my name is Patricia Atkinson.
My name is Connie Jo Bunn, and this is my son Matt Bunn, and he is forever 26.
My name is Beth Moore, and this is my son Pearson Moore, and he is forever 21.
So we could just take a moment of remembrance, please. Thank you each for being here. We have a small token for each of you. If you have it, please.
No, it has to her. It's fancy.
Oh.
You didn't know the answer. It's hers.
You are welcome to introduce yourself, please.
Yes.
I just didn't want to take the time for them. My son's parents, Obama Ford. His name was Rakim Ford, and his drug of choice was Obama Ford, and it made him dangerous, threatening, and like I told you, I was part that he had a lot of stuff in him. So I don't know if fentanyl played a part, but you know, my heart goes out to y'all, and I just try to like, Obama Ford is a different little thing, but we grieve every day. I cry every day. Y'all don't know the story behind my son attacked me. He shot at me. So in defense, I ended up taking my own child's life because he was high on Obama Ford, but I didn't know, never heard nothing about it. Obama Ford's for dead people. I never thought you can ingest it. He started smoking weed. He was dipping in blunts, cigarettes. And when he died, the mayor, from home, we went to school together, and I was like, I never knew this. And I was looking in the casket, and he looked so natural. Like, you know, when you die, you look swollen or something. He looked so natural. And my mom told me, she said, they couldn't embalm him. And I was like, what? He had so much in him, they couldn't embalm him. They would have busted him open. So that lets me know, if that can do that to you, it's just I never understood it. And to me, he was my baby. He was married. He was running a business, but I don't know if it's peer pressure or life, but I thought as a parent, I taught him well and stuff. You start questioning yourself as a parent. And like, where did I go wrong? Because my other child, they raised in the same household, 2-parent household, but where did I go wrong with this one? It eats down to me every day to think that he was trying to take my life. And I knew it was not him. It was not him. But that's how Moms on a Mission came with Patricia's son, fentanyl, and then everybody else with fentanyl and vomit floor and stuff. So I didn't know where to go for help at. And I got him in rehab. They couldn't help him because they said it was a poison. So, but that's our story, how Moms on came, and we try to cut out the community help and try to be that support system. All right, thank you.
Thank you for sharing. So as we just heard, addressing addiction, addressing fentanyl misuse is not a simple thing to look at. There's no single person or organization in our community that's going to have the magic fix for such a complex challenge. It touches healthcare, such as our public health, such as education, and our families. Because of that, it really does require a thoughtful and coordinated response. One of the roles of the coalition is to help to bring together cross-sector representation of our community, to have those important conversations, to better understand what resources already exist, because there are resources already available. However, we also have to identify and address the gaps that we see. And so part of what we want to do is bring community partners together to address those gaps. With that in mind, we are very grateful to have several community partners with us here today to share their efforts and their perspectives on their work. This work reflects the kind of collaboration that is essential for making meaningful progress, and we appreciate their willingness to be a part of the conversation today. So our first guest is Deputy County Manager Ms. Lori Winstead.
Good afternoon, everyone. You all have my sincere condolences for what you all have been through with your children. I am Lori Winstead. I am here to represent Wilson County government and to share with you what we are doing with our opioid settlement dollars. We are very grateful to be able to use our settlement funds to provide access to treatment, raise awareness, and continue with education. Our focus is to provide access to resource and continue that collaboration. We as a government entity, we cannot put your child in treatment, but we can provide funding so that your children can go to treatment. And so we do that through great partnerships and collaboration. As we continue to fight the opioid crisis, we use our settlement funds, like I said, to assist with treatment, education, and to reduce stigma. The ways in which we're using our settlement funds, we do access to evidence-based treatment, Naloxone distribution. You spoke about having Naloxone available. You have it in your car, you have it at home. And we work really hard to make sure that we are saturating our community with that. We do early intervention, syringe services programming, recovery housing support, and then our work with the coalition with collaborative strategic planning. We are focused on spending our money to help save lives by providing access to Naloxone, focusing on effective programming, and investing in prevention. Prioritizing equity and focusing on being transparent. We want you all to see that we're using our funding to provide access to those who need help. We are grateful for our many supporters. We have partnerships with the coalition, with the health department, with EMS, with DSS, with our county schools, and with many other agencies across our community. We hope that we will continue to make Wilson County a better community. able to provide support and funding to those who need the most care. So thank you so much for allowing me to be here.
Before he has a seat, I want to acknowledge that Jeff is in the room today. He is our he's on staff here at the coalition to help with coordinations of the opioid settlement funds. I just want to acknowledge Jeff. Thank you. Next is Ms. Lori Wilson with DSS.
Good afternoon. Just wanted to say thank you to the parents that are here that are willing to share your story, because it is so powerful, and thank you for being willing to share it with the rest of us, because your message is one that we all need to hear. And I'm here because I'm with the Department of Social Services, and I am the team lead for our county opioid multidisciplinary team. This team is a fantastic group of all different kinds of organizations. We have everything from government agencies, healthcare, the coalition, law enforcement, school systems, colleges, universities, treatment providers, behavioral health providers, reentry staff, various community organizations. There are more than 50 organizations represented by a group of dedicated professionals. We also have people with lived experience and family members with lived experience. So I would invite all of you to, if you'd like to participate, to be part of this team. But this is a dedicated group of folks who get together monthly and work on issues in our community related to opioid use and access to treatment. Our post-overdose response team is part of this group. We track numbers, we look at data. The emergency room director is part of this group. She comes and gives us data each month. EMS gives us data each month. It's just a dedicated group that comes together, and we've been the boots on the ground in a lot of ways for activities happening in the community. But I do want to invite you, if you're interested in participating in this group, you can reach me through my email. It's lwalston@wilsoncounty.nc.gov. It's an open meeting, an open group, so the public is welcome to participate as well. We meet tomorrow morning. We'll be on Zoom tomorrow, so if you're interested, I can shoot you a Zoom link to participate. And we try to meet in person every other month. Tomorrow we'll be on Zoom, but next month we'll meet in person, most likely at the Department of Social Services. But I want to thank everybody who's part of this group. You keep the work moving. I mean, that's the thing. And it's amazing to see the partnerships where people come in the room. You know, there's no competition. There's no, this is my turf. No, it's all, let's work together. What can we do to address these problems and make a difference in our community? So thank you all for being here. Thank you for all that you've shared. Thank you everybody else for the work that you do, because it truly does make a difference, and we've seen it make a difference, and that's fantastic. And thank you for letting me speak.
Next is Ms. Salita Graham with the Health Department.
Good afternoon, everyone. So as she said, I am Salita Graham. I am one of the health educators at the Health Department, and I'm here to speak today on behalf of the Naloxone. So what Naloxone is a drug that is used to reverse an opioid overdose. So those are usually administered, and when they are administered, what it does is it blocks the opioid receptors in the brain. So we actually offer trainings in the community on how to administer Naloxone, and we also work with EMS. So they're usually our partner and the coalition when we're out doing these different trainings. So if you ever want us to come out, do any trainings, if you need Naloxone for yourself or anyone else, just let us know, and we'll be able to provide those for you. There are two different types that we pretty much have now in our, that we circulate in the community. The first one is the Revive. So you might see this box in various places around the community. And the second is the Patagosprin. So we do have these two that we actually circulate. And so as far as the signs and symptoms of an opioid overdose, what we really want you to look for is someone that is unresponsive. Their skin might be cold and clammy. They might have blue lips, blue fingertips. If they might be choking or making gurgling sounds. But if any of that you can, if you suspect that they are having an overdose, you can administer the naloxone. Here in North Carolina, we do have the Good Samaritan law, so that will not get you in any type of trouble if you administer this drug to someone that you suspect has an overdose. And basically what you do is you would lay that person on their back and you will tilt their head forward just a little bit, and then this is a nasal spray that you use. So you will just put it up one nostril, and then you will put them into the recovery position once that is done. So basically you're just laying them on their side to make sure that there's no aspiration or anything occurring. And before you do all that though, I failed to say that we need to call 911 first. Before doing any of this, make sure that you call 911 first. And then in the meantime, as you're waiting on 911, if 3 to 4 minutes have passed and that person hasn't come around, these packets usually have 2 doses, so that way you can administer the second dose if EMS has not arrived yet. So that is one part of my little spiel today. The second part is just to let you know that the health department does have a mobile unit, and on our mobile unit, it's been in operation now almost a year. July will be 1 year for us as far as operation, but we do offer programs on this unit, as Lori both both said that, you know, we have harm reduction services on the mobile unit. We offer Naloxone. You can get trained with Naloxone on the mobile unit. We also offer testing, so we offer Hep C, HIV, and STD testing. Once a month, we do offer immunizations as well as WIC services. So if there's anyone in the community that needs resources as far as WIC, you can come see us on the mobile unit. We do have a website, we do have our mobile schedule on the website, so that way you can see where we are. But I appreciate your time today. Thank you.
That sheet sits, I want to just really quickly introduce Mr. Dancy. He is on the mobile unit, and so we actually had Mr. Dancy and Lucy. I think she had to leave, but she's also on the mobile unit, Ms. Dancy, and they brought the mobile unit out today. So if you're interested in seeing that when we wrap up, he's out. It'll be out there, and Mr. Dancy would be happy to give you a tour. And if you haven't had the opportunity to meet Mr. Dancy, I encourage you to do so. He's solid there. He would do anything for your family, so he's your guy. All right. Next we have Esteban. He's going to come up and talk a little bit about our post-overdose response team.
I try to stand still so that they can see me, but interviews have ever been done in my trainings, I can't do that. So I'll do my best. First, I want to thank you again. You know, we've met quite a few times, and every time you guys come out, it's an inspiration to all of us. The stuff that you guys have gone through, and then to continue fighting, it means so much to the community. And I'll just say even further than that, it means a lot to me. So thank you again for Moms on a Mission. You guys are amazing. So,
What's the name?
Fentanyl Awareness. Yes, ma'am.
Moms on a Mission and Fentanyl.
Sorry, I'm terrible with names. Again, that's another thing I have issues with. But today we'll talk a little bit about our post-overdose response team. It is a great partnership that we have here in Wilson County. We partner with the Coalition and RC3. Whenever we have a overdose in Wilson County that EMS responds to, our crews actually give them our port kit. So inside of it, the box itself is a lock box to keep any medications or any type of things that you want away from people inside and secure. Inside of it, we have a sharps container, we have education resources, we have a drug deactivation kit, we have Naloxone, and then what I find biased a little bit is a release form that allows us to make contact to them. To me, that is one of the most important aspects of it is we can make contact to offer our resources. Myself and a peer support specialist make contact with them every Wednesday on and offer them the resources we have. It could be something as simple as just a conversation, coming out to meet in person because people tend to do a little bit better on that, and checking them out and doing assessment, vital signs, and then continuing them along the pathway to recovery. We, again, work with all the partners associated with the coalition, and inside of that is also all of their information as well. It is something that we hold very dear in Wilson County, and it seems to do a really great job. Again, thank you guys for coming out, listening to me for a few minutes. But if you guys have any questions afterwards, I'll gladly answer them. Thank you.
Ask Ms. Terry to come forward. I will not make you speak, Terry. I promise. As she's coming forward, I wanted to introduce the other staff from the coalition, just so you have some faces to go with what you hear us talking about. So, okay, next we have Daquan. He is, I'm not gonna try to say their titles because I get it wrong every time. Daquan is one of our peer support specialists, and he works a little bit with prevention, he looks a little bit with recovery. He's kind of all across the continuum. Then back here we have Anna. So all of the wonderful social media posts that you see, all the education that you're seeing online, community relationships and things like that, that is Anna. Then we have Ashley. She works on one of my favorite parts of the continuum of care is prevention. So how do we help a child from ever getting to the point where they're having to face addiction? And so I think that's just as important as every part of the work that we do. So there's Ashley on that. Have I missed anybody? Oh, Kimberly, you'll get to hear from in just a minute. She is our brand new RC3 coordinator. So you'll get to hear her in a minute. And then I think lastly we have Pamela, not last but not least, Pamela, who works diligently with us on gathering data related to our community and what's happening. And I always tell her I hate data, but I realize the importance of data. And without that data, we don't know what in the world we're doing. And so her position is just invaluable to our work because it guides the decisions that we make as a coalition. It guides the decisions that our community partners are making to see where the needs really are. Did I forget anybody? Because it's there on purpose. Okay. Last we have Ms. Terry Pierce. She asked me not to have her speak, and I'm glad to do that. But I wanted you all to be able to have a face to go over what I'm here to talk about, because this is a critical component of community partners coming together and making resources available to our loved ones. And so Terry is the face of the Hope Alliance, which is a wonderful partnership that is directly with the police department and a lot of community partners. I know Coalition, DSS, Health Department, Mobile Unit, Port, all of us know about Hope Alliance and how to make referrals to Hope Alliance. And what that is if an individual is ready to seek treatment, they can either spur of the moment come in and see Terry or call her in advance to schedule an appointment. And if she's not available, she's actually getting ready to train some other people on how to do that in case she needs a vacation day or a lot of babies are going to be born in our family. And so this is a service that is available to any member of Wilson County. It can be someone who has no insurance at all. It can be somebody who has Medicaid, Medicare. It can be someone who has private insurance. But when you get that sticker shock and you're like, my family doesn't have $4,000 just sitting around to send a loved one to treatment, this is a resource that is available. And so I just wanted to have the opportunity, or I wanted Terry to have the opportunity to just for you all to have a face with that. And Terry is the perfect person for that role. She is very loving to people who walk through, and there is no stigma associated when they come in. It is just, how do we get you help? And she truly is available. Had a family member actually walk into a family walk into our office last week. They said, we're ready. And we said, okay. And we sat with them in our office. We called Terry. So it's truly like, let's walk you through it. We don't even have to send you in your car to go somewhere. We will talk with you on the phone and get you started in that process. And so thank you, Terry, for your services. If you're not aware of it, if you want more information about Hope Alliance, please reach out to Terry. She's happy to talk one-on-one. So with that, thank you, Terry, and thank you for all of our community partners. And one of the last pieces of our formal agenda is Ms. Kimberly Redance, and we intentionally saved her for the end of the agenda and tied it directly to Hope Alliance because you will hear her story and her relationship with Hope Alliance.
All right, so hi everyone. Full disclaimer, if I stumble over words, it might happen because I'm very overwhelmed with emotions and I was not thinking I was going to be. But with that being said, hi everyone, my name is Kimberly Redance and I am the RC3 coordinator at the Wilson County Substance Prevention Coalition and the North Carolina Certified Peer Support Specialist. Today we remember and honor every precious life lost to the fentanyl epidemic. To the families carrying the unimaginable weight of grief, please know that my heart is with you. Your loved ones matter, and their lives have value in the past, present, and in the future. Their stories matter. Their memories matter. Their lives have a lasting imprint, and they will not be forgotten. Even in loss, their lives continue to have meaning through the love they gave, the lives they have touched, and the awareness their stories have today. We want to take a moment to recognize the parents and families who have turned pain into purpose by speaking out, raising awareness, and fighting to protect others. Your courage is making a difference. We must continue to talk about prevention, education, harm reduction, because lives can be saved. Naloxone saves lives. It offers a second chance, a moment for hope to break through, and I know that second chances matter myself. I share that hope from my own recovery journey. Hope Alliance is where I had my second chance. Since 2023, I have not felt the need to pick up and use. And that is the power of recovery. I stand as living proof that healing is possible, and a life once touched by addiction can be restored. That is why I believe every life is worth fighting for. I am deeply grateful for the parents who have become advocates in the face of loss and those standing against fentanyl distribution for our communities. Your voice does matter. Today we remember, we raise awareness, and we hold on to hope that recovery is real and lives will be changed. Romans 15:13 says, "May the God of hope fill you with all joy and peace in believing, so that by the power of the Holy Spirit you may abound in hope." As we leave today, we may be abound in hope. Hope for healing, hope for recovery, hope for life still being saved, and hope that together we can continue turning awareness into action and loss into purpose. And as many of us in recovery knows and believes, we do recover. And with that being said, there's one thing that I do want to share that's not on this paper, and I didn't know if I was going to share it or not, because I don't want to take away from what y'all are doing here today. But I want you to know Naloxone saved my husband's life. He got a bag of heroin with fentanyl in it, and he died in front of me, and I was able to bring him back with Naloxone. So the difference does matter. We also want to give a special thank you to the Wilson Flowers and Market for providing the flowers we are giving to you, that we gave to you today. They're on Raleigh Road. I reached out to the owner, and he was more than happy to donate them for us today because of the special cost. So I do want to say thank you for his kindness, and he helped us honor y'all today, so thank you.
So as we come to a close, I want to thank you all for your presence today. Thank you for those of you who were able to be here in person, and those of you who were able to join us virtually. Your time, your willingness to show up, and your vulnerability in being a part of such an important and often difficult conversation is greatly appreciated. Addressing fentanyl and addiction and its impacts takes all of us. And your engagement today is a meaningful step towards being a part of the solution, and we are truly grateful for you being here. At this time, we'll formally conclude the program, but we welcome